So, welcome everybody. Thank you so much for joining today for this very relevant session on cancer and constipation, on managing constipation. Um, Many of you have probably attended Anika Jagasia's her sessions before, but she is fantastic. She is a friend of Woman to Woman and a friend of the Mount Sinai Cancer community. She is a graduate student. She has a passion for the interplay between the body and functioning and wellness. And her lectures are always so interesting, so informative, so well researched. And she volunteers her time to do this. So thank you so much, Anika. We are just thrilled to have you back. And I'm going to be quiet and I'm going to just turn this over to you. And if you don't mind, just reintroducing yourself and then we can get going.
Mhm. Sounds great. Thank you so much, Rachel, for that super kind introduction. I appreciate it. Hi, everyone. My name is Anika. I will start the slideshow. Can everyone see my screen? Yes? Okay. One moment. Okay, so hi, everyone. Today, we're going to be going over managing constipation and a little bit about myself. My name is Anika. I'm currently a master's student getting a master's in clinical nutrition. So I love sharing my little niche interests and doing these presentations and sharing what I learned with you all. And I thought constipation is a super very relevant topic that we all deal with every day. And when Rachel suggested it, I was super excited and also interested in researching it and then making a presentation to share with you all. So today I'll go over the different types of causes of constipation. I will introduce it, the lifestyle changes, practical strategies to improve our digestive health and how our digestive health connects to constipation. And then I will end with some tips to manage and reduce discomfort when dealing with constipation. So we can begin by defining constipation. What is constipation? So constipation is defined by less than 3 bowel movements per week, hard or dry stool, and painful or difficult bowel movements. In constipation, it's also super common to feel that not all stool has passed. And while I was researching this, one of the statistics that I came across that stuck out to me was that it actually affects many people, and about 33 out of 100 adults aged 60 and older have symptoms of constipation. So I think this just really shows how relatable and pertinent just being constipated and constipation is in general. And who is most likely to be constipated? So constipation affects specific groups more frequently. I came across an article on the NIH that noted the different types of people to be more affected. So the article described women, especially after giving birth, older adults, people who eat little fiber or no fiber, and also people who are taking certain medications and supplements, or those with certain health concerns, including functional gastrointestinal disorders, are at higher risk for constipation. And the common symptoms of constipation include infrequent bowel movements, hard or lumpy stools, straining during bowel movements, and abdominal discomfort or bloating, similar to the definition that we also went over. And I also thought this explanation was super interesting that I came across about the longer it takes for a stool to move through the large intestine, the more it loses fluid and the drier and harder it becomes. And this is pretty interesting because it relates to hydration, and we'll talk about that later, and just the importance of being hydrated, and also just the impacts of being dehydrated on like your ability to like pass through the stool. Um, I was also looking at a couple of research studies about like how common it is, and I came across this one that noted that constipation is actually one of the most common digestive complaints. And in the United States alone, there are about 2.5 million doctor visits each year due to constipation. So that means that many go to laxatives, but it's also important to spread like education and awareness about like constipation as a topic, because patients with knowledge on self-care for constipation can like reduce their severity and also just improve their quality of life. And so now moving on to what causes constipation. So there are a variety of factors. These include like this delaying of emptying of the colon from pelvis floor, slow movement of your stool through the colon, and the main three topics that we'll talk about after this: certain medications and supplements, a individual's like daily routine and life changes, and certain health and nutrition problems. And as well as functional gastrointestinal disorders like IBS. It's also important to like just keep in mind that sometimes like being aware about constipation is important because it can lead to like seeing a doctor. It's actually really important to consult a doctor if constipation persists, despite like self-care, especially if like there's a history of colon cancer in the family. So symptoms that include a need for medical attention are the following: like bleeding from your rectum, blood in your stool, constant pain in your abdomen, inability to pass gas, or the experience of lower back pain. Um, One of the biggest ones is losing weight without trying to. So these are just important to know, and later on we'll also talk about the importance of like tracking sometimes, like your bowel movements, and tracking them and like being more aware of them can help like catalyze the idea of seeing a doctor. I was really interested in looking at these certain medications that can worsen constipation. To be completely honest, I'm not sure what all the medications do or how they like work on a biomolecular level with our like intestine. But some medications like pain relievers and anti-nausea drugs can lead to effects that like slow down bowel motility, as well as like other lifestyle changes. I thought this was really interesting to learn that some medications can actually like cause constipation by like specifically affecting the muscles and nerves in our colon, or actually like causing our body to absorb more water from the colon. So these medications are changing our like levels of homeostasis, which can change our ability to like pass stool and even like the movement of stool. And these are three different factors for potential causes of constipation in people like with cancer. There was a special like constipation site on one of the cancer websites that I attached at the bottom of the slide that really goes into detail about the role of like medications, physical activity, and dietary changes, and how like as we just learned that some medications can like really slow down your bowel motility by changing your level of like homeostasis. Physical activity can also really affect your like bowel functioning, and that's usually corresponding with a like less decrease in physical activity and different foods that can like lead to constipation. And that connects with our other factor, which is dietary changes. And also sometimes those dietary changes lead to like reduced fiber intake that somebody's not aware of, but then that actually can like lead to symptoms of constipation. So now, like moving on to tips for managing constipation. To manage constipation, it's super helpful to drink plenty of fluids. Coffee and prune juice actually are two fluids that have a very like laxative effect. And physical activity really aids in digestion because exercise, even light exercise, can really improve bowel movements. And also keeping track of our symptoms and just like keeping a log and talking to your doctor, like we learned before, can also really support like effective treatment. And so going over like treatments, like what can people with cancer like take for constipation. This was a super interesting site that I found on the National Cancer Institute site that talked about like the different stool softeners, stimulant laxatives, and osmotics, and how they work by, like, for example, osmotics, which pull water into the body from other parts of the body. And this like really helps make it easier to have a bowel movement. And stool softeners, and how stool softeners actually like soften stool by like increasing the amount of water and fat, and also stimulant laxatives. I included some of the generic names if anybody like recognizes any of these, and it could be helpful in the future. Yeah. And then I also wanted to include some tips for
Sorry, just to chime in. I just wanted to, as always, just say, if you are considering starting any of these, please just make sure you do speak to your doctor beforehand, just to make sure that it's, they don't interact with any medication that you're taking or any other health issues. Again, it's from a very, very reliable source, but you always want to just check about your specific situation.
Yes. Thank you, Rachel. I forgot to say that. And so for managing discomfort, there's a few like great benefits of using like heat for just massaging and just stimulating bowel movements. Warm compresses have been shown to like really help the abdomen by like relaxing the muscles and also reducing discomfort. Warm compresses, like one example of like implementing a warm compress could be using heating pads. And then there's also an interesting blurb about the effect of mindfulness on managing like discomfort when it comes to constipation, because when we're practicing like relaxation techniques and mindfulness, the effects of like deep breathing and meditation just really lead to progressive muscle relaxation, which ultimately like really helps bowel movements, because sometimes when we're so like tense and clenched up without knowing, we're like subconsciously clenching all of our muscles. And so here's some tips that I've compiled for a just general digestive health routine. So in the morning, daytime, and evening, there's a couple of stuff that we can do every day to like really help our digestive routine. Starting with like warm water, as we just spoke about, like the effects of like warmth on like relaxing our muscles, is really great. It's a really great way to start our mornings, and also like incorporating a very like fiber-rich breakfast. That's really great to like help our gut bacteria and our entire colon. And in the daytime, like including fiber-rich snacks and staying hydrated. I think staying hydrated is one of the most important things that we've gone over in this presentation, just because like the effects of dehydration on our body, and also when it comes to just like holding in like stool in our colon for a longer time, that can become like progressively drier, can just entirely be combated by staying hydrated. And in the evening, it's really great to like have a walk after eating. Like usually walking after eating really helps stimulate our like digestive system, and also sometimes immediately after walking, like our muscles are able to just like move around a little bit more, and that's more beneficial than if someone were to just lay down after they ate. And now going over some practical strategies for constipation relief. There's two different strategies that I thought would be important to share with you all. Routine and timing, which is just like trying to keep track of your body on a very like routine, like daily basis, like setting like or scheduling like bathroom visits after meals, like just keeping track of this. And also probiotic foods. Probiotic foods are really great for our gut, and it's feeding our gut like really great healthy bacteria, and healthy bacteria along with like fermentation in foods such as like yogurt and kefir are really great for aiding our digestion. Okay, so moving on to the practical strategies for constipation relief. Additionally, I decided to incorporate like toilet positioning, and just the importance of like our positioning when it comes to like elevating our knees and the benefits of using a footstool. And that can really like make our bowel movements easier, and also just like being relaxed. I didn't know like prior to researching this, the effect of or the impact of like relaxation versus just like clenching or like tightening or just being kind of like stressed when it comes to like keeping our muscles tight. So relaxation like really helps loosen our muscles and even like loosen or just help us have bowel movements. And then here's a slide about the squatty potty, and if it works. So this goes along with our practical strategies to help constipation. So the squatty potty basically works by just changing the position of our body, and also just changing the angle at which we're sitting at. And this really helps to open up our rectum for an easier bowel movement. And so this picture just shows that it does really make a difference. And to highlight the difference, I looked at some research studies, and overall, after looking at a few, I noticed that the like major consensus is that the squatty potties do really help people, and it's a really easy way to like help manage constipation. I did come across a couple of studies that noted that there are not like significant differences, although like individuals noted improvements, but the actual like significance was not like statistically significant. But it's actually using a squatty potty is a very like inexpensive option to treat or prevent constipation, and it can also benefit somebody's like or reduce somebody's visits, medical visits, and also use of like long-term laxatives. And then, like I was talking about earlier, another type of practical strategy that's great to implement is tracking symptoms. So, for example, like keeping a digestive journal, and that includes like logging in like bowel movements, and also triggers to better like understand patterns and areas for improvement. And this is really helpful when it comes to like noticing and keeping track of like certain foods such as like dairy or coffee or like fermented food, and just like remembering that like certain foods are like really helpful for an individual's bowel movements, and like some foods can lead to like a prolonged period or a couple of days of constipation. This also helps when it comes to doctor visits, because keeping a log helps like the doctor better understand like sometimes the timeline of somebody's symptoms without them having to like guess. And there's a lot of additional like resources and support for like seeking out like advice, and also like alternative ways other than like long-term laxative use for constipation. So the hyperlink attached at the bottom of the slide is the website for like the photo that I inserted that talks about like the benefits of like a high fiber diet in more detail, and just more about constipation in adults. And most of my sources are included at the bottom of every slide, but overall, like these were three main sources that I used. Yes, that's my presentation. Thank you all for listening.
Thank you so much. So interesting and so much to think about. I think the the thing that's most interesting is the squatty potty because it's a completely non-medical intervention, so it just seems like such an easy thing. And I believe that was a Shark Tank invention because both of my kids had constipation issues. And I remember the pediatrician recommended, and when I ordered it, I remember it says like all over Amazon, and it's not expensive. It says, as seen on Shark Tank, which I think that's one of their most successful products that they ever endorsed, which is so interesting. I think we can turn it over to questions because we have some time. But I actually was wondering, because I know this plays into what your interests are, but you do mention a bunch of times the benefits of a high fiber diet. And I'm wondering if maybe you could even talk people through almost like a mini meal plan, like what are some ideas for breakfast that are high
Yeah.
fiber? What are some just, dinner snacks? Just because I think, that's also, a kind of easy, aside from adding medications or supplements, that seems really easy. And I know people all like dietary, nutrition related stuff. So,
Yeah. Well, I guess first I would just like to say that I am like still getting my master's in nutrition and I'm a first year, so I don't know a lot of things. But from what I've learned, high fiber diets are really beneficial because it gives our gut, well, we're feeding our gut like lots of good, diverse gut microbes, including like whole grains and just a variety of vitamins and nutrients that's just feeding our gut microbiome. And that's more like beneficial than, for example, like eating like something that's very sugary and like high sugar fructose corn syrup based cereal. That's not going to like help our gut as much as a like multigrain like avocado toast. So because I'm a little bit aware of having a high fiber breakfast, I usually go for, I really like Ezekiel bread or like multigrain bread. I go for those with avocado toast. Sometimes like in the winter time, I will have like some squash on the side. I usually, I found that like eggs, like learning about eggs in school has been really great too, as a like really great sustenance and also just breakfast option because of all the vitamins, nutrients, healthy fats, healthy proteins that it has for us. And that's also like yogurt, Greek yogurt especially, and granola. Um, but definitely like really sugary cereals are not great for us, or like um, even though breakfast muffins are really great, sometimes if they're like super sugary, they're not that great for our gut.
and any other suggestions about, snacks that are high fiber snack?
Yeah. Some of my favorite snacks are actually the like nut and seed crackers from Trader Joe's. Usually when it comes to snacks, I try to go for more like nut seed options or like cracker versions that are like healthier or have like more types of like seeds in them, just because seeds have like folate, they have like so many other vitamins and nutrients in them, and they also can keep us like full longer, especially when it comes to like nuts, like trail mix. That's usually what I go for like snacks. But I also think that like hummus is really great because it has like so much protein from the beans with veggies as a snack. That's a really great like fibrous snack with the like carrots or any cruciferous vegetables. Yeah.
Great, all good ideas. And is there something I tend to just, especially, I've been running around a lot, for work or when I'm working from home, do smoothies. Is there anything to add into the smoothies that make it sort of give a little extra fiber? Because I know that you can sneak all sorts of stuff in there.
Yeah. So in the past, I've actually used like frozen cauliflower and frozen zucchini, to just like as like fiber, like fibrous veggies in my smoothies, and it actually creates like a thicker texture, so it doesn't really affect the taste, but it creates like a more like smoothie bowl-ish like feel. They're really great. So those are like a couple of veggie add-ons I like to add in my smoothies. I've also loved adding in like dates for like the extra sweetness in my smoothies. Yeah.
Thank you so much. And most importantly, thank you to the amazing woman to woman community for not just being here, but for sharing, your thoughts, your resources, your support with everyone. Anika, thank you for all the work you put into this and for being such a valued member of the woman to woman team. And good luck, everybody. Keep us posted. If anyone has updates, if you try any of the stuff, you get your squatty potty, you know, learn more about the pelvic floor, please reach out so that we can, that we can get an update.